This is why Big Pharma always wins. When we look at pharmaceutical companies right now, the big push is for GLP-1 drugs. Ozempic, Wegovy, Zepbound, Mounjaro. But whether it's GLP-1s, statins, SSRIs, or any other drugs, Big Pharma never loses. And here's the truth. These pharmaceutical companies don't care what happens in 10, 20, 30 years from now. They don't care what happens to patients if side effects start showing up decades later. And they're not worried about the chance of lawsuits piling up either. Why? Because they've already priced it in. Litigation's just a line item expense. It's a cost of doing business. And if you think this is exaggeration, let me show you exactly how they're playing the game. Let's start with the mindset of the executives running these pharmaceutical companies. Their careers are built around one thing: quarterly earnings. If revenue goes up, Wall Street rewards them. If revenue dips, their stock options and bonuses are going to take a hit. So what do they optimize for? Immediate growth. Think about it in any other area of life. If you get rewarded for doing something right now, regardless of what the long-term ramifications of that thing are, you're most likely going to optimize for that immediate return. So those executives optimize for the immediate return. Not patient safety, not long-term outcomes. And here's the thing, should any problems start showing up from a particular drug, by the time they do, those executives are going to be long gone. They'll be cashed out, sitting on a yacht, lying on a beach, and the next CEO has to deal with the liability. This isn't a conspiracy theory. This is human nature. This is how humans are wired. And it's how the system is structured. It's just unfortunate that in this situation, it involves public health. Shareholders want short-term returns. Executives are paid on short-term results. Everyone gets paid for making hay while the sun shines. And right now, the sun is shining on those nice new GLP-1 drugs. And just think about the reality of this. The CEO is perhaps going to have a tenure of maybe 5 years, maybe 10 at the most. The CEO wants to get results for the company in their tenure. There is no reward for that CEO for getting long-term results. If the company sees growth that stems from that CEO's tenure in 20, 30, 40 years' time, no one cares. Most especially when it involves a profit-making machine like a pharmaceutical company. So if we focus on the GLP-1 drugs, let's look at some of the numbers. Novo Nordisk's GLP-1 drugs generated over $28 billion in 2024 alone. Demand for these drugs is insane, and the pharmaceutical companies have even had trouble keeping up with demand. So what are these companies doing? Well, they're expanding production, but what they're also doing, which is increasing demand, is they're expanding indications. First, these drugs were for type 2 diabetes, then obesity, then cardiovascular benefits, addiction treatments, fertility, and it's going to go on and on and on. And if you're an executive, why wouldn't you be riding this wave? You're not going to have to worry about any problems later. In fact, if you're really focused on results and growth, you're going to be pushing to discover more indications for your drugs. And if all that's not bad enough, consider this. When any drug eventually causes harm, and with GLP-1s, we're already seeing lawsuits for things like gastroparesis, intestinal blockages, vision problems, things like that. When these problems happen, the company doesn't panic. Why? Because the lawsuits are already factored into the business model. Think about all the pharmaceutical companies that have had to pay billions in settlements. Those settlements didn't bankrupt the companies because the drugs generated far more revenue than they are ever going to need to settle for. But it gets worse. Under tax laws, these settlements are often deductible business expenses. Companies can literally write them off against profits. which means the taxpayers who were harmed by these types of drugs also end up footing the bill for the settlement. So if a drug makes $200 billion over a couple of decades and costs $20 billion in lawsuits, some of which is a deductible business expense, the company comes way out in front. So let's put it all together. Step one is to exploit demand, flood the market, expand indications, and capture as much revenue as possible. Step two is to cash out, executives collect their bonuses and get some career prestige, move on to some other company. Step three, when the lawsuits come, stall, drag them out in court, and eventually settle without admitting any wrongdoing. Step four, write it off, deduct the settlements as a business expense. This isn't about long-term health. This is about short-term profits and growth. And to discover how we got so sick in the first place, check out this video next.